Yeah, I think pulmonary hypertension for the general practitioner is going to be much less common than the other diseases that they deal with on a day-to-day basis. It's an extremely complicated disease to diagnose. It's associated with more than 40 different associated diseases. So it's a massive task, and I think it would be quite unreasonable for us to expect in general practice, when there may be one in every few thousand patients you see, to have this as your primary thought process. Having said that, breathlessness again would be the key factor that I would be encouraging general practitioners to focus on, and I think if we can have a focus on breathlessness and the concept that breathlessness is important, then referring on to somebody else who may have a more heightened suspicion of pulmonary hypertension is going to be the secret to their success. I think the main thing for the specialist community is to really think of pulmonary hypertension. Patients present with breathlessness of some particular form, and having pulmonary hypertension as one of those top 10 things you would consider just in itself is probably 3/4 of the way there. So I think if there was cardiologists, respiratory physicians primarily, who deal with more common diseases like ischemic heart disease or coronary artery disease, chronic obstructive pulmonary disease, and things like asthma, which are much more common, and that's their bread and butter type areas. And if they could just keep this as one of those options in their diagnostic thought process, I think we'd do much better. I think that if you're a patient and you go and see a doctor and you present with breathlessness and the outcome of that discussion is treatment X, you go home, you have treatment X for a period of time. If you don't go back to the doctor and say that treatment X is not working, then that physician's unaware. So patient responsibility, absolutely. If you go back to the doctor and the doctor dismisses you and says, "Oh no, it's nothing really, you've just got a bit of anxiety, or you're unfit, you've put on a few kilos, you're getting a bit older," then that's a physician-generated responsibility. So I think equally both parties need to pursue an outcome where the breathlessness, the symptom of whatever the symptoms are, it could be sore feet through to a devastating disease like pulmonary hypertension, but whatever it is, as a community, we need to continually ask the questions and don't take no for an answer. Time is essential.
Yeah.
It's really very much about having pulmonary hypertension as a thought process. There's no question that if you don't think that it could be pulmonary hypertension, you've got no chance at diagnosing it.
Yeah.
Time's incredibly important. I think there's a lot more to be done. When people think of breathlessness at the moment, there's not the same kind of sense of urgency as there might be with, for example, chest pain. Yet the outcomes could be very similar. And so we certainly, as a society, we'd be encouraging the specialty community to really increase their suspicion of pulmonary hypertension. It's much more common than we've ever thought it was.
Time is valuable.
Time is hope, yeah.